Namaskar dosto, welcome to our channel Toxicology on board. Today this video will discuss about question number 10. The topic is metals, mercury, chromium, uranium and nephrotoxicity. This question was from DABT recertification question. The question is which of the following metals is or are nephrotoxic? Option A mercury, option B chromium, option C uranium, option D B and C, option E A, B and C. The right answer is option E, A, B, and C. Mercury, chromium, uranium, all these three metals will cause nephrotoxicity, kidney toxicity. So through this video, we'll try to learn few basics about kidney toxicology as well as how these metals are affecting the kidney toxicity. Not only we'll learn about kidney toxicity, how these metals are affecting other target organs also we'll try to learn from this video. Okay. So this is the basic uh, 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 background, basic picture consisting of urinary system, which contains, as you can see, these are the important arteries or veins which are which are major part of the urinary system. Okay, in that we are talking about only kidney because nephrotoxicity is basically the functional unit of kidney is nephron. That nephrotoxicity we are going to discuss in this particular video. So if you look at the outermost structure of the kidney, it consists of a, if you are taking a transverse section, you are seeing renal medulla, renal cortex, renal pelvis as well as ureter. And if you look at the functional unit of kidney, which is nephron, this is the you can say again more in microscopic structure, you can say. If you see, this is the mainly it contains renal cortex and renal medulla, in which you can see collecting duct and renal pelvis is there. This in detail, if you go in depth, you can see that glomerulus is there, and you can see both efferent arteriole and efferent arteriole. And major important thing what we need to learn is proximal tubule, okay, distal tubule, collecting duct, as well as descending and ascending loop of Henle. Okay, these are the these things you try to remember. You can go back and read in detail. The once you understand various parts, important parts of a nephron or kidney, then only you will be able to understand how the toxicants are affecting the these particular uh, uh, particular part of that kidney or nephron. Okay, this is very important in understand mechanism of toxicity actually. First option we'll discuss about mercury. Coming to mercury, molecular, as we know that atomic weight is 80 as well as molecular weight is 200. It is a major toxic metals. If you look at toxicology of metals, basically they are classified as major toxic metals and minor toxic metals. Another class is also there. So mercury comes under major toxic metal, present in lot of industries and natural resources, as it is very abundantly. This mercury is used in various industries and it is abundantly found in the nature also. It cycles through again. It cycles through environment. Again, this is very important point. One has to remember that mercury undergoes biomagnification or bioamplification. Okay, because of its lipophilicity nature. Mercury vapor is lipid soluble and has high affinity for RBC as well as CNS. That is the reason it is going to affect the hematopoietic system as well as CNS. Mercury is going to have adverse effects on these two. So whenever there is acute exposure to mercury, you will find corrosive bronchitis as well as interstitial pneumonitis will be there. Okay, in the patients. And whenever there is chronic exposure with respect to mercury, CNS effects will be there. That is micromercurialism. Micromercurism is again very important term. um, Even at lower concentration, how this bioamplification biomagnification is taking place, that you have to learn about mercury. And the symptoms include tremors, tachycardia, increase in the heart rate, thyroid enlargement, gingivitis, spasm of extremities. So in these patients, you can see that tremors will be there. Their hands, continuous hands and limbs will be shaking. Next, swallowing mercury from broken. So one thing in the olden days, now though we have digital thermometers, but earlier they used to be glass thermometers, which used to contain liquid mercury inside the thermometer. So You might be thinking that if the thermometer is broken, if there is any oral consumption of this mercury, will there be any toxicity? One, we have to again understand one of the important principles of risk assessment is there. Hazard is there, a chemical is there in your vicinity. Okay, for example, you're sitting here and in a bottle, certain formaldehyde, some is there, but the bottle is closed, cap is closed, it is sealed. So hazard is there within your vicinity, in your presence, but you are not getting exposed because exposure is not there. So this is a very good example where mercury is there. It is in the glass thermometer. Since it is still not broken, you are not getting even if it is broken and accidentally have consumed. Certain times children, they play. So if such a case also happens, even then at that time there will be it is stating that it is cause less toxicity because it is poorly absorbed from GI tract. So again, kinetics is coming into picture. It is very important to understand that even though it is having high lipophilicity, GI absorption is less, because of which there will be low toxicity. Okay. So route of exposure is also one of the very important component whenever there is toxicity of a certain chemical. Next, mercury, but not methyl mercury. So again, we need to understand that mercury exists in two forms. One is organic mercury, another is inorganic mercury. Organic mercury, best example is methyl mercury. Okay, and inorganic mercury, mercury chloride is there. Other mercury salts are also available. So what it is stating that, but not methyl. So this inorganic mercury induces metallothionein only in the kidney cells, becomes because these particular inorganic mercury, metallic mercury, it gets localized in the lysozymes. So again, this is our question was how mercury is causing nephrotoxicity, because of the localization in the lysozyme. Metallothionein only in the kidney cells it is happening. Next, damages the proximal. So the here when we saw the basic structure of nephron, where we have seen that proximal convoluted tubule is there. So mercury is going and depositing the PCT. These proximal tubular cells are damaged. This is the major target site, you can say, where mercury is causing toxicity in the kidney. Causes a proximal tubular necrosis and acute renal failure within 24 to within 1 to 2 days. You will have acute renal failure is there, and it's called necrosis. It is irreversible damage. Okay, so these are the various biomarkers through which you will be able to understand whether kidney damage has occurred or not. Whenever these elevations is there, alkaline phosphatase or GGT, then you can say that kidney toxicity is there, bulky. Okay, mechanism, as you have seen, if you go much detail, we have understood the site was PCT, proximal tubular cells. How it is causing me in these cells, it is causing mitochondrial damage, because of which there will lipid peroxidation and possible immune complex formation will also takes place. Okay, now as we have seen, mercury atomic weight 80, atomic number is 80, atomic weight is 200.59 in the periodic table. So through this particular slide, we'll try to understand how mercury, when it is exposed to a certain individual, what are the other target organs it is affecting. Okay, first we'll see lung. uh, Mercury, whenever a person is sick, it affects the lungs. What it causes respiratory failure, it causes lung irritation, it causes impairment of pulmonary function, chest pain and dyspnea. Okay, difficulty in breathing. So at cellular level, it is causing microtubular destruction, mitochondrial damage. So in the previous slide, you have seen lipid peroxidation, and it is also causing genotoxicity, means it is affecting DNA damage. Okay, remember this point, very important. The next, mercury, when it is exposed to a pregnant woman, it is affecting fetus. Developing fetus is getting affected. It is getting damaged, as well as neural system. So in the fetal, brain as well as neuron development will be impaired because of the mercury. Because probably mercury, because of its lipophilic nature, I guess it is crossing the placenta. It is reaching the fetal circulation. Still, the baby is not yet formed. Fetal stage only. It is affecting the fetal. Next, mercury, how it is affecting reproductive system is, it is affecting, in the case of females, it is causing abnormal menstrual cycles, and it is causing reduced fertility in both males and females. Okay. Coming to mercury, how it is affecting kidney, it causes kidney damage, impairment of kidney functions. Means before at nephronic level, PCT level only, efferent or efferent arterioles, if they are getting obstructed, there will be kidney function impairment will be there. Yeah, then how it is affecting digestive system? In earlier slide, we said that even though at low doses, kidney toxicity is less because of the low GI. If larger amounts are consumed, means it is causing GI system, gastrointestinal system damage, vomiting and diarrhea is taking place. And coming to nervous system, kidney, it causes neurodegenerative disorders, Parkinson's, Alzheimer's. As we have seen, it causes continuous tremors. Okay, and locomotor activities, those things will be getting affected. Changes in the nerve response and mini-matter disease. So one question you need, one important topic that you need to remember with respect to mercury is mini-matter disease. Mini-matter disease by itself is a very big topic. Very briefly, I will try to tell over here. Uh, in Japan, during, I think during early 30s, I believe, there was one chemical company called Chizo, which was preparing a lot of chemical. It was a chemical industry, so it had some effluents, some wastage from the industry. Major part of this effluent in industrial wastage was contained mercury. That mercury, so at that time, no. This particular factory industry was close to a river body, or you can say sea. So they started draining this industrial waste into the river bodies. So what happened is that mercury started accumulating in the river bodies. So it was taken up by the phytoplankton, then it was taken up by zooplankton, then it was taken up by smaller fish, then taken by larger fish. So and these fishes were consumed by the local population as well as the domestic animals like cats and dogs staying nearby. So what has happened is, throughout the food chain, the mercury concentration in the food chain got increased. Okay, and there were a lot of cases where the patients who were having high concentration of mercury in their body, they started showing tremors, parkinson like symptoms, you can say, but it's not parkinson. They were unable to even hold a small cup, that much weak they have become. And neurodegenerative, locomotion, these type of adverse effects have taken place. Not only that, mini disease, no, it has also affected not only single generation, it also affected first generation, second, the babies which were born after first or second generation, they also started showing neurological symptoms. Teratogenicity or fetotoxicity, all these things were also there. So maybe some other time we'll make a detailed video on minimatter disease. But for time being, remember that mercury, methyl mercury, it causes what a minimatter disease. And mercury also affects brain damage, poor performance in test of mental function. As I said, coordination, lack of coordination, those things will happen. So this was about the first option, mercury. Now we'll learn about the second option, chromium. As I previously said, these metals are classified as major or minor toxic metals. So this is major toxic metal. I think this is based on abundance, how likely the exposure is there. That is called, that classification is abundant in the earth crust. People exposed mainly through so food which is produced from the soil, which is having a high concentration of chromium, through which also so one of the source of contamination, chromium exposure might be with through food also. Basically, some of these metals now they exist in oxidation or valence state. So chromium exists in valence oxidation state 3 as well as 4 as well as 6. Today we will only discuss here 3 one. Other oxidation valence state chromium are also available. If you want to understand chromium, if you read ICH Q3D also, in that various oxidation states are given about chromium. Okay, today let us stick to the topic. Chromium 3 readily crosses the membrane and is more toxic valence state of chromium, and is reduced to chromium 3 inside cells. Accidental exposure leads to tubular and glomerular damage. So we have to remember, our question was which of the following metals will cause kidney toxicity. So chromium is causing tubular and glomerular damage. Okay, mercury was causing PCT damage, and now chromium is causing tubular as well as glomerular inside the nephron. Glomerulus, that is getting damaged, and it is causing skin ulceration, all due to hexa. So all this is because of the chromium 6 form, hexavalent form. And chromium 4 causes respiratory tract tumors by generation of this reactive oxygen species, and there is no mutagenicity activity with respect to chromium. But in case of mercury, you have seen that it is causing genotoxicity. Remember this point. Okay, now next, let's see. Chromium 24, and atomic number is 24, atomic weight is 51. And let's see how the chromium 6, imagine the same thing for other oxidation states also, how the chromium is affecting all other target organs, we will see. So chromium, if it chromium affecting on hematological disorders, how it is causing iron deficiency anemia. There are various types of anemias are there, aplastic anemia, pneumocytic anemia, so many things are there. I would request you to, because one topic on anemia definitely you will definitely get in your exam, so read about types of anemia. In future we'll try to make one slide only on types of anemia. Then apoptosis in human lymphocytes, so lymphocytes are permanently damaged, apoptosis. And how it is causing skin problems, chromium, hair loss, skin ulcers, allergic reactions in skin. Here you can see that skin ulceration is there. One question you will definitely get on which of the following metal will cause hair loss. So maybe apart from chromium, some other metals are also there which causes hair loss. So remember chromium for hair loss. And respiratory problems, lung, nasal, and sinus cancer. As you have seen that respiratory tract tumors by generation of reactive oxygen species, airway blockage, difficulty in breathing. Then chromium also causes kidney toxicity, affecting the kidney function and finally damage. Same like mercury you have seen. And here also we'll see nephrotoxic effect, tubular dysfunction and renal failure. Here also we have seen tubular and glomerular damage is there. Then how chromium is affecting GI tract is gastrointestinal tract, weight loss, change in the gut microbiota. As we know that there are few microbiota in our gut which are very important. So even that those which are useful bacteria we call them. If those are also getting affected, then there will be some harmful or it will disturb the GI, whatever the acid balance will be there in the GI tract, that will be get disrupted. More infections will be happening. Then hepatotoxic effect, how the chromium is affecting, it is causing reduced viability, apoptosis in the liver cells, damages. Liver has a regenerating capacity as we all know. If this viability and apoptosis it is causing, then liver regeneration will get affected. And coming to reproductive effects, how chromium is affecting, it is affecting both male as well as female reproductive system. Yeah, so you have seen in the case of mercury also, it is decreasing the fertility, both males and females. Here also it is affecting reproductive system, both male and female. So next we'll learn about the third option. Third option was uranium. So unlike other two metals which were major toxic metal, this is a minor toxic metal and it is a major nuclear fuel. Uranium. We have uranium is there. Other radioactive metals we have strontium. We have other radioactive metals are there. Very important topic in radiation toxicology. 60% as uranium exists as soluble bicarbonate complex, rest bound to plasma protein. 60% is excreted in urine within 24 hours and 25% is fixed in the fixed in bone. Retention in lungs is prolonged, so very important. Uranium is going and depositing in the bone. Okay, so whenever certain tissues like bone or adipose tissue, if a certain metal or chemical is getting going and binding protein, this binding to these specific tissues is there, then their half life will keep increasing, unlike other tissue binding, protein binding. Uranial ion will cause acute renal damage. So now we have all the three options which are causing nephrotoxicity. So let's see how uranium is affecting. This is the structure of uranium. Atomic number is 92 and molecular say atomic weight is 238.02. So how uranium is affecting all the similarly like other two metals, let's learn from this particular diagram. So how uranium is affecting brain, it is causing neurotoxicity. It is hinders locomotion, okay, cognitive dysfunction, sleep dysfunction, neurodegeneration. So in mercury also you have seen these things are there, cognitive dysfunction, okay, um, difficulty in movement, okay. Then how it is affecting, how uranium is affecting lungs. Pulmonary toxicity is causing uranium, you can see in the lung fluid. We have various fluids, pleural fluid, alveolar fluid will be there in the case of, so uranium you can see in the lung fluid. Lung cancer it is causing and it is causing lung fibrosis. So earlier in chromium also you have seen that it is causing respiratory tumors, so here also it is causing pulmonary tumors, lung tumors and lung fibrosis. Fibrosis is more damaging or more destructive when compared to other types of tissue damage. The next, how uranium is affecting kidney, we'll see it will cause us proximal tubular damage, nephritis, and renal failure. So similarly, like mercury, the site of action where it is causing to the proximal tubular damage. And coming to uranium, how it is affecting liver is, these are all biomarkers, cholesterol, AST, all these things will be increased. Okay, as a result, liver toxicity will be there. And how it is affecting bone toxicity, as we have seen that 25% is getting it deposited in the bone. So damaged osteogenesis, So we know that bone formation also there is a cycle osteogenesis, osteoclast formation. There is separate big cycle is there through which how the bones are formed. So that osteogenesis bone formation is getting damaged. Cortical bone damage it is causing low osteoid thickness. Even if by chance bones are formed, there are less thickened bones are formed, brittle bones are formed. You can see how uranium is affecting reproductive toxicity. It is damaged in oocytes, testicular sperm defect, low sex hormones. So these are the things which is uranium is a. Now overall, let's see. One picture we have taken it from. I have taken it from Clayson. We can go back and check on page number 779. Another diagram here will come here. One more diagram will come 782 page. In this, no, what I want you people to remember, or it will be helpful for your exam is this is a typical, not complete kidney structure, but nephron structure. You can say functional unit of kidney. So in this particular diagram, they have given both what are the common chemicals or drugs which are causing toxicity, as well as biomarkers they have given. Biomarkers I will not discuss in this video. You pause the video, or you can go back to the textbook and read. Drugs I will try to discuss over here. First we'll see distal tubular. The green color portion, it is called distal tubule. So these are the drugs: amphotericin B, antibiotic, calcineurin inhibitors, lithium, which is another metal, sulfadiazine. All these one are causing distal tubular injury. Okay. Coming to next is tubular obstruction. It is done by acyclovir, which is anti-HIV drug, indinavir protease inhibitor, again it is an anti-HIV drug, methotrexate and sulfonamides. All these four drugs are also causing tubular obstruction here. So flow will be disrupted. Then next, interstitial nephritis. This particular region, it is caused by these drugs. Allopurinol is there, which is anti-gout drug, aristolytic acid, cephalosporin antibiotic, ciprofloxacin. So these are important thing you need to remember. NSAIDs. NSAIDs also cause kidney damage. Acute renal failure is there with respect to NSAIDs. And you can see penicillin. Antibiotics also they are causing this interstitial nephritis. Okay. Other things are given here. Phenytoin, which is anti-migraine, and proton pump inhibitors are also there. Okay, markers you try to read on your own. Okay, proximal tubular injury, this blue color region, this is caused by acyclovir. Again, see acyclovir having two sides, it is disrupting. One is tubular obstruction as well as proximal tubular injury. Aminoglycoside, cadmium. Another question you might get: which of the following metals, cadmium, lead, these are causing proximal tubular injury? Like this, they might club certain questions. And already we have learnt about mercury chloride, which is an inorganic form of mercury. It is causing proximal tubular injury. And next we have thrombocytic microangiopathy. Here you can see calcineurin inhibitors. Here also you can see calcineurin, which is causing hemodynamic alteration. Calcineurin inhibitors causing distal tubule. This is the way they will club the questions, I mean to say. Okay. So you try to memorize these drugs and certain chemicals, where the target organs are there, which particular region within the organ. Also you should be able to know. If you want to read mechanistic toxicology, then you need to definitely know. Next one is in detail how methyl mercury is affecting these cells, how it is causing metallothionein complex. All these things is there. So I will request you go back to 782 and read in detail. This is molecular level, at cellular level, how it is damaging is there. Okay. I believe that from these examples, no one or if you understand these mechanisms, you will definitely get one or two questions. Okay. So in this video, we learned about three metals. One is mercury, chromium, as well as uranium. How their toxicity is there with respect to kidney, as well as other target organs. Also, we have read. And if um, we have also seen how the other class of other drugs, where they are affecting other regions of various regions of toxicity. So drug induced DIKI, one topic you can definitely read. Drug induced kidney injury. Another topic will be drug induced liver injury will be there. So like that you have to remember. Thank you so much. Be curious. For any questions, please comment or write mail to arya.priyanka18@gmail.com. Like, subscribe and follow my YouTube channel Toxicology on board. All the best for your exam.